BioBalance Healthcast, episode 158, Diagnosing Hypothyroidism.
BioBalance Healthcast features conversations about positive aging. Your hosts are Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging, and Brett Newcomb, a licensed professional counselor.
Today we're going to talk about thyroid disease, specifically hypothyroidism. And it is one of my favorite subjects because I've had this problem since I was in my 20s. And I've gone through the history of how we diagnose it, how we treat it, and it has changed over time greatly. It is also one of the hormones that I don't think doctors replace to an optimal level. And therefore, I think there are a lot of people whose thyroid is not working, who are either told they don't have thyroid disease when they do, because I don't know why. They just are told that. And then a lot of times when patients are given thyroid medicine, they're given the very lowest level that can possibly bring them into the normal range, which doesn't solve their problem.
Well, but you do know why some of this is done this way. You know that doctors have heard somewhere in their early training that thyroid replacement leads to arrhythmias and heart attacks. And so they're conscious of that and trying to avoid that, and they don't necessarily know that the message has been updated and that that's no longer believed to be true.
In fact, thyroid's needed to protect the heart.
Reflexively, they go, oh crap, you'll have a heart attack.
Yeah.
You know? So we can't do that. You also know that there are problems and questions around the determination of normal.
Right.
And you know that there are differences between treating symptoms that are manifested by observing the body and talking to the patient and looking at lab results when normal on the lab results is not dependable. So let's talk through all of those things that you do know and then see where that takes us.
Okay, that's fine.
Okay.
One of the things that really bothers me is when someone comes in with all the symptoms of hypothyroidism and their doctor has given them a tiny little dose of thyroid, just enough to shut their own thyroid down, not enough to make them better.
So if you give me a thyroid medicine, if my thyroid is working but not enough, and you give me a thyroid medicine, it actually turns mine off and uses the other, the body does that?
Yeah, and it uses what I've given you. So it feeds back to the thyroid and says, oh, we have enough here, and shuts down the thyroid function. Okay. But that means I have to give you more
than enough.
More than what you were producing before to actually bring you back to health. My second gripe is nobody talks to the patient. Nobody says, not nobody, but most people tell me in my office their doctor never asked if their symptoms were gone. They just look at the lab sheet and go, you're fine, now on to the next question. That's not treating a patient, that's treating lab. And treating lab makes no sense because labs can be wrong. I mean,
well, but again, it makes sense the way medicine is done. When you are doing a high-performance medical office and you've got less than 6 minutes per patient, you have to go through a checklist.
You know,
whether it's electronic or paper.
We should not crumple under that. Because
you've
that's not
that's
not medical care. That could be done by a computer. You have to look at somebody. There are signs that you can look at. Just somebody sitting right in front of me. I can look at them in the way doctors are supposed to look at them. I can look at somebody who's in a restaurant and tell if they've got low thyroid. And that is now a thing of the past because everybody's typing.
Well, there was an article or a cartoon that you showed me a couple months back of a new medical visit, and the doctor never looked at the patient. The patient came in, but he never looked away from the screen. Because he was inputting his data and checking what the computer was telling him to ask, and never turned and looked at the patient.
The one thing a doctor can do that a computer can't is look at the patient. And determine through experience and training what's wrong with that patient. And then ask the appropriate questions that then confirm this.
So if I come in and I have a conversation with you, and I have actually done that, and you don't have a computer sitting in front of you when we talk. And you say, well, why are you here? What's going on? What are you concerned about? And I start to talk about my symptoms. These are the things that I'm noticing, that I'm wondering, does this mean anything? Is there something wrong? You know, like I'm always cold, or I'm always hungry, or half my eyebrows are falling out and I don't know why. Is it normal?
And your hair's thinning.
Thank you.
All over your, no, I don't mean that.
We were speaking rhetorically, but.
No, I don't mean your hair is thinning. Most of the time women come in and say, my hair is thinning, and it's obviously thin.
Yeah.
but it's not. But there's lots of reasons for your hair to thin. We've talked about those. But the kind of hair thinning that you get from low thyroid is, I can see these broken ends all the way up. That's not from necessarily over-processing. It's usually coarse, it's usually broken, and then you can see the top of their scalp. Sometimes I go over and go, can I look at your scalp? Just to see if it's really
well, you
thick
see these
there.
little old ladies that just have really, really thin hair on the top of their head.
That's like all the hormones.
Yeah.
Low thyroid, low estrogen, low testosterone. That's
wow.
all of the hormones. They just haven't had it replaced. Their hair falls out.
Yeah.
So that's all of our future if we don't take our hormones and get back to normal. But having said all of that, the symptoms of low thyroid that I look for,
right.
Not the signs, but when somebody comes in and tells me their problems. The first one's fatigue, but fatigue can be many things. So I consider that fatigue can be your lifestyle, not just a hormonal issue. Then when patients tell me they're cold, when they tell me that they're, exhausted at the end of the day,
mm-hmm.
they just can't get through the day.
Mm-hmm.
Then their skin's dry. Their mouth even may be dry. They have gained tons of weight. Their wedding ring doesn't fit. They're all swollen. And the weight is actual fat.
It's not salt. It's not water retention.
And water retention.
Okay.
So they say, I can't fit into anything. I'm all swollen.
Mm-hmm.
And then the next one is, I'm constipated. About once a week I have a bowel movement and I'm like, whoa, that's not good. That's like never taking your trash out.
Yeah.
You need to get it out of there
sense, that's like
every day. It needs to get out.
Mm-hmm.
So that's not good for you. That's actually stimulates diverticuli in the colon and infections, and it decreases our immune system because all of that bacteria is attacking our immune system. So all of those things are told to me. I usually give patients a list, and I say, just check off what's bothering you. And when they
I have that list.
You have that list. And so when they check off many of these things, then I hone in on their thyroid. And then I start looking at them that way.
Mm-hmm.
I start looking for the loss of the lateral eyebrow, the outside of the eyebrow. They have eyebrows right to the center and
mm-hmm.
then nothing out here.
Mm-hmm.
So that's a problem, and that's the only specific symptom of low thyroidism that we can find. There's nothing else that's just thyroid.
Visible to the outsider. If I'm telling you
right.
that I feel puffy or I'm tired all the time or my mememory isn't working the way that it was,
mm-hmm.
you can't measure that. You can't see that. But you can
right.
see
I can see
the eyebrow.
this, and then the other thing is a goiter, because
mm-hmm.
usually there's an enlargement here,
mm-hmm.
right?
I remember as a kid growing up, I used to see people have like a fist-sized growth on the...
You grew up in Arkansas, and
yeah.
I grew up in Missouri, and we're in the goiter belt. So that means none of us got enough iodine if we ate the food that was grown in our own states and we drank the water. So that's one of the reasons there's so many goiters walking around, and that is a sign usually of hypothyroidism and secondary to lack of iodine. If you go long enough without iodine, you get a goiter and your thyroid gives up. The thyroid hormone's made of iodine.
Mm-hmm.
It's tyrosine plus 3 iodines or 4 iodines. That's what makes T3 or T4. So you need iodine to make the hormone. So that's something else I can see. And I can see the broken hair. I ask about nails.
So you might give somebody an iodine supplement as well as a thyroid supplement?
Yes, especially in this area.
In this area.
Because it's very common.
Mm-hmm.
Or I have them eat kelp. And kelp isn't that easy to eat. Kelp you have to get at an Oriental food store. It's usually dried and it's in sheets.
Mm-hmm.
And then you have to do something to make it palatable, or you have to put it into a shake. Like you put in, what is it? You put in all kinds of green stuff. Kelp, kale.
Mm-hmm.
So you put in kale so you can throw in but that has iodine in it as well. Mm-hmm. So those are 2 ways to get iodine. We don't eat iodized salt too much anymore. We don't eat salt too much anymore.
No.
So iodized salt was how the government decided to give us our iodine, but we don't do that anymore.
Everybody's eating sea salt.
Right, sea salt.
Mm-hmm.
And there's not necessarily a lot of iodine there.
Mm-hmm.
So, and it's not fortified.
Mm-hmm.
So that's an issue. The other thing is fluorinated water. Fluorinated water, which as good as it is for our teeth and cavities, it is, if you had iodine in your water anyway, it knocks the iodine off. So you don't have iodine in the water anymore if you fluorinate your water.
Okay.
So those are all causes. It's more common in women than men. Women need more iodine. We usually starve our thyroids by, it's interesting, when we grow breasts, iodine goes to our breasts and starves our thyroid. So that's why many people get hypothyroidism at the time of their period starting. And so that's, I see one group then, and then I see another group, which has nothing really to do with the iodine, at the menopausal time. And we haven't related that to estrogen or testosterone, but it does happen. All of those glands that age with us and get old and don't produce a lot, that often happens at the same time as menopause in women. So those are the times I look for.
Okay.
Now, the signs are something a doctor would look for, or you could look for in your partner or your friends or your children. Then
now obviously once a quarter. I mean, by walking, you see that right away, just like you see the eyebrows once you tell yourself to look for them.
Right, and then I ask other questions. That's what doctors do. They see a sign or they hear a symptom, and then they go down that road to see if that's an issue. And then oftentimes what I do is ask them to take their basal temperature, have them take some iodine supplements, and then recheck it. And most of the time it doesn't get better. It's been burnt out. So then I have to replace the hormone.
I thought the only time people took their basal temperature was when they were trying to get pregnant. Yeah.
Right. And one of the most common reasons not to get pregnant is hypothyroidism. Those women, and I honestly didn't really embrace that part. They didn't talk about it in my infertility training. But one of the reasons that women don't have a temperature rise with progesterone is because their thyroid doesn't give them enough temperature or enough heat for them to ovulate.
Yeah.
And thyroid is required for ovulation.
Right.
So thyroid has to go to the ovary, has to help the ovary ovulate. If your thyroid's low, you're not going to ovulate. You're not going to get pregnant.
Because one of the functions of the thyroid is to regulate body heat and temperature.
Right. That's right. And progesterone also stimulates temperature. That's why we say once your temperature's up in the second half of the cycle, you don't have to keep having sex because you're either pregnant or not.
You don't have to, but you could.
You can if you want to, but you don't have to for procreation.
Yeah.
Yeah, I knew you would think of it that way.
Wow.
So it's also needed, a normal thyroid's needed for us to procreate, but it's also needed for us to be healthy after we're finished procreating.
Okay. So what other signs then do you look for? Brittle nails and hair? Brittle in the sense that, like, people complain about having to have their hair trimmed because they've got split ends, that sort of thing?
Right, and that their hair falls out, and it falls out not in long, it falls out in short lengths and long lengths, and then they don't see as much hair growing back. Baby hairs don't grow, and so those are signs that your thyroid's not working, your hair's not growing. Usually that's immediate. Usually when I start thyroid on someone, the hair stops falling out.
Okay.
And that's a very quick
sign that things are getting better.
That we've hit the right thing, and that's why the hair was falling
And again,
out.
You're still not talking about lab normals.
I'm not talking about lab normals. I'm talking about signs, symptoms, and a basal temperature without using a lab. That's what we used to do in the old days when lab wasn't available. We used basal temperature. It actually seems to reflect what the patient's going through more than the laboratory.
Especially because, and let's talk about that for a few minutes, when you send a patient to a lab to have blood work done, you get a report back, a printed computer sheet from the lab saying these are the values that we found for all these things you asked us to look at. And one of those would be thyroid, and it'll say plus or minus a normal range. So where does that normal come from? Who decided that was normal?
Good
or
question.
How did they decide?
The normal that has been used forever is the normal that was done in the early 50s or late 40s when they tested 29-year-old medical students, and they were all men, of course. So it's the male normal. And we now know that there are gender differences in normal.
Is that an always male normal or just a young male normal?
It's a young male normal. In general, medical students at that time were young.
Right.
So it was a young male normal that they devised then. Now the test has changed. We're in the 3rd generation of testing.
Okay.
They had a very crude test then. Now we have 3 generations, and we now have women and gender differences that we know about in the thyroid. Women have a lower TSH that's tolerable. Okay, so let me go over that.
Okay.
TSH is thyroid stimulating hormone. I view this as a reflection of the thyroid function. TSH comes from the pituitary. It is secreted into the bloodstream, goes to your thyroid, and stimulates your thyroid to produce the 4 thyroid hormones, 2 of which are most important, T3 and T4. So TSH, if it starts going up, that means it's pushing the thyroid harder, and the thyroid, it may have normal levels of hormone, but it's being stressed and it's being pushed just to make low normal. So that's a sign to me that the thyroid's either not functioning perfectly. I caught it at a time when it was being pushed and was functioning well, but it is a sign that doctors use always to determine thyroid function. Most doctors don't even do any testing on T4 and T3. So they look at the TSH, which is like looking at a mirror of something, but is not always associated with low thyroid levels, and it is not always an accurate reflection of what the patient's
I knew you were going to say that
through.
about the mirror. Yes.
Yeah,
that's why they put those signs on the mirrors that said objects in the mirror may be closer than.
Maybe larger than.
Yeah.
But to me, I talked to my vet because I thought my dog's hair was funky and he had all these kind of weird things, and his diet was, he needed a different diet. So, but that's not what I thought at the time. I thought his thyroid was abnormal. I said, I think he needs to be tested. And my vet was nice enough to humor me, and she changed his diet and tested him, and he had. I said, are you testing the TSH? She goes, why would I do that? And I said, because that's what MDs do. And she said, that's ridiculous. All I want to know is if they have thyroid hormone. So I test T3 and T4. She said, why would I test the reflection of those, which is not always accurate?
So vets know more than doctors do.
Obviously, they're more practical. And doctors have had the luxury of doing testing, and vets are paid by cash, and their clients or their patients the owners aren't going to tolerate that very long, so they just go right for the diagnosis, which is your actual thyroid level, which is, I test all 3 of them because sometimes the T3, T4 looks fairly normal, but the TSH is elevated. So that tells me, that's like a crystal ball. Sooner or later, that thyroid's going to go in. Patients may already be symptomatic. The other issue is that on that lab sheet, they don't put a normal for women. And we've known that now it's 20 years. We've known that women have a normal TSH.
Do they know what it is?
Yeah.
They just don't put it on there as an option?
They just don't put it on there.
Okay.
And I've talked to the labs, of course, who am I? And I've asked them about it, and they said, well, that's what we've always done.
Doctors aren't asking for it, or insurance companies are not asking for it, or we don't make that distinction?
What they do is, that means many women, and especially women, aren't being diagnosed. Because the women's normal is if all you're doing is TSH, women's normal is, it should be less than 2.5. And then even in some studies, 2.0. And then in the men's normal, it should be less than 4.4. So if a woman is 3.5, then her thyroid's struggling. And if she has symptoms, she should be treated. But they don't treat them. They say, you're normal. The doctors say, you're normal because you're within the men's normal, which is not normal for a woman. So many women aren't being treated. And it is one of the most rampant untreated problems in the U.S., and it causes many diseases and other things that we're treated for. So it's kind of like testosterone. If you don't treat this, then you're treating a whole bunch of other symptoms and problems.
It reminds me of another symptom that you were telling me about that I don't see on the, swollen tongue.
Oh, that's right,
and
swollen
tongue. You get those like tooth indentations in your tongue if your tongue's too big for your mouth.
Right. My favorite is swollen tongue with teeth marks on the sides. It kind of looks ruffly, so you can stick your own tongue out,
like
look in the
potato
mirror.
Chip. Yeah.
Yeah,
Right around
it
the
looks
edges.
roughly
Yeah.
just on the edges where your teeth are biting into them. And that's one of the things that I'll ask patients to stick their tongue out in the office. They think I'm crazy, but that's what I'm looking for. And often that's one of the easiest things to find is a swollen tongue. And there's not many things that cause your tongue to be swollen chronically all the time,
Right.
except low thyroid. So when I find that and I find these other things, even if the lab's normal, I'm going to treat the patient.
Right.
The
Because
test
you're not
could
treating the lab.
I'm not treating a piece of paper. I'm treating the person sitting in front of me. And that's what we should all be doing. It isn't over-treatment. If the symptoms are there and you give them the treatment and the symptoms are gone, that's medical care. That's what we should be doing.
Which brings us to a good stopping point. We've talked about thyroid as a concern and a problem, and iodine and the role that it plays and the signs and symptoms. Now you're at the point where you're pretty emphatically talking about treatment. So next time, let's talk about what you do for treatment and what issues, if any, there are around treatment concerns.
Okay.
All right, so come back next time and learn about treatments.
Email your questions or comments to podcast@biobalancehealth.com. You can find the BioBalance Healthcast on iTunes and on YouTube. For more information about bioidentical hormone pellet therapy and other reverse aging solutions, visit biobalancehealth.com or call 314-993-0963. You can find Dr. Maupin on Twitter @Dr. Kathy Maupin and on Facebook at facebook.com/biobalancehealth. Find Brett Newcomb at brettnewcomb.com.